Do you have jaw pain? Did you know most jaw pain is actually jaw muscle pain, not jaw joint pain? Your TMJ is the temporomandibular joint, but most of the time, that's not the problem. You might even think you have a toothache when in fact it is the jaw muscle that hurts. You can get referred pain from your jaw muscles that makes you think a tooth has a problem. You can also get referred pain from your neck and shoulder muscles that makes you think you have jaw pain. How can you tell if it's jaw muscle pain and not a tooth? 1, does the pain come and go? If it goes away for a few days or a week or 2 and then crops back up for a few days, it's often muscle pain. 2, if you can press on your jaw muscles and it's sore or uncomfortable, that's a hint. Muscles shouldn't normally be painful or sore to press on. If they are, it often means they're being overworked. See how I'm pressing on the jaw muscle? Shouldn't. See this? This shouldn't hurt. You push right here and right here. That shouldn't be painful. 3, does it get worse when you eat, but you are able to press on each of your teeth individually without any pain? If so, the pain is probably coming back because you're working the jaw muscles by chewing. 4, is it worse when you wake up in the morning? You may be clenching or grinding your teeth at night. 5, do you also have a stiff neck or sore shoulders or upper back? Does any of the discomfort radiate up the side of your head? That could be another jaw muscle, the temporalis, getting sore. This is where, right up here by your temple, it's a fan-shaped muscle called your temporalis on your temple. Let's say you've identified that you have jaw muscle pain. Not jaw joint pain, not a toothache, you have jaw muscle pain. Very common source of pain in the face. What do? We're going to follow the MEAT protocol. MEAT stands for movement, exercise, analgesics, and treatment. This is a physical therapy protocol for muscle recovery. Technically, you need physical therapy and behavior modification for this much more than you need a dentist like me. Step 1 of the MEAT jaw muscle injury and pain recovery protocol, movement. The goal is to move your jaw within a painless range. You don't want the pain to restrict you from moving altogether, right? You don't want to be scared to use your jaw, but you want to be cautious. We want movement within a painless range. This may sound a little silly, but if you yawn, you're going to want to restrain your jaw from opening too wide. You can even use your hands to hold it closed if necessary. Weird as that may sound. You're going to want to avoid chewing gum. That's too much repetitive chewing. It's too hard on the jaw muscles. You're going to want to switch to a soft food diet. What's a soft food diet? What does that mean? Basically, anything you could cut with the side of a plastic fork. Stuff that doesn't take too much effort to break up. Nothing crunchy, nothing chewy, sticky, gooey. You're going to want to use the jaw, but stop when it hurts. Ideally, stop just before it would hurt, right? You should be able to get a feel for that. Step 2 of the MEAT physical therapy protocol for jaw muscle pain, exercise. There are several simple things you can do to gently relax your jaw muscles and move them in a safe way to recover full function. 1, a lot of times when you're having jaw muscle pain, it's because you're subconsciously clenching your teeth. People get frustrated with this. Subconsciously means you're not aware of it. Your body is doing something your mind is not focused on and aware of. Patients tell me all the time, like, I never clench my teeth. And then they show all of the symptoms of someone who clenches their teeth. You're doing it even though you're not aware of it. I know that's confusing, but you can become more aware of it with a little bit of practice. 2, stress is a major factor. Lots of us clench our jaws when we're stressed out, when we're highly focused on something, when we're working out really hard. You know, we go into that sort of fight or flight response, right? Our nervous system kicks into high gear and a bunch of our muscles tense up. This can happen without you being consciously aware of it. Three, what do? Well, 1, you can practice tongue yoga. What's tongue yoga? Basically, you put your tongue to the roof of your mouth. This reflexively separates your teeth so you can't clench. Try it out. Tongue baby cobra, if you know your yoga moves. Tongue upward dog. Do this gently. don't push the tongue hard because you might tense your muscles more that way. 2, slow down your breathing. There are a bunch of different breathing patterns you can adopt to do this. You can breathe in for a count of 5, hold for a count of 5, breathe out for a count of 5. You can breathe in for 8, out for 8. You can kind of make it up with whatever numbers you want. You just want to make it slow and steady. The goal is to slow down to about 5 or 6 breaths per minute on average. If you can comfortably get to less than that, great. Don't overdo it. I don't want anybody getting lightheaded, but this is a way to counteract that fight or flight response from your nervous system. Slowing your breathing down kicks you over to the rest and digest side of your nervous system. It relaxes your muscles. That's what you want. For bonus points, you can even start doing yoga on YouTube. I'm on YouTube teaching dentistry and how to keep your teeth healthy, but there are lots of excellent yoga teachers on YouTube who can help you get control over your breathing during a consistent yoga practice. Get into it. It's really good for you. 4, sometimes when you have jaw muscle pain, you can also have restrained jaw opening. It hurts to open wide. If that is the case for you, there are some exercises you can do to help. 1, do tongue baby cobra again, tongue to the roof of your mouth, but this time you're going to gently open and close your mouth within a painless range as you're doing that. This isn't awkward at all. Do 10 reps and do that about 6 times a day. 2, you can gently stretch your mouth open wider each day. How do you do this? You can use tongue depressors. You stack the tongue depressors between your teeth until you are open wide enough just before it would become painful. You want a light stretch, but no pain. Do that again 6 times a day, about 20 seconds each. Add an additional tongue depressor each day. That'll help you stretch open more gradually over time. 3, you can massage your jaw muscles. I have jaw muscle pain myself every once in a while. A few times it's gotten very bad, and I've used all of these techniques. I'm no expert in myofascial massage, trigger point massage, deep tissue massage, so I'm not going to pretend to give expert advice on that here, but I have found relief from massaging my jaw muscles when they're in pain like this, and there are physical therapists who will do jaw muscle massage and walk you through exercises like this as well. Step 3 of the MEAT protocol for treating jaw muscle pain, analgesics. This is pretty simple. The best pain meds for jaw muscle pain, if you can take them, are NSAIDs, non-steroidal anti-inflammatory drugs. That's ibuprofen or naproxen, Advil or Motrin, that's ibuprofen, Aleve, that's naproxen. Ibuprofen, you can take up to 2,400 milligrams in a day. Naproxen, you can take 1,100 milligrams in a day. Do not overlap these medications. It's one or the other. You can overlap one of these with acetaminophen, right? That's Tylenol. Ibuprofen and acetaminophen can be safely taken together. Naproxen and acetaminophen can be safely taken together, but do not take ibuprofen and naproxen at the same time. If you do take ibuprofen with acetaminophen, you can stagger the doses 3 hours apart from each other for best results. Naproxen has a longer half-life, so you're only going to take that once in the morning and once in the evening as needed. The acetaminophen can be taken every 6 hours. I want to emphasize the last thing you ever want to do with muscle pain is to take opioids. Opioids only mask pain. They don't do anything to treat it, okay? Jaw muscle pain is related to activity, overworking the jaw muscles either consciously or unconsciously or both. You have to treat the cause of the pain by getting the muscles to rest and relax and recover. You have to help the muscles heal. If you mask the pain with narcotics and then go on functioning in the way that is harming the jaw muscles and also possibly the jaw joint, you set yourself up for chronic pain. Chronic pain is bad. If you have chronic pain, it can mean that your nervous system has been fundamentally altered through a process called central sensitization. If your jaw pain goes on for a long time, you can actually train your nerves to send pain signals to your brain. Then, even if the jaw muscle recovers and is relatively healthy, the nerves can keep on sending pain signals to your brain. That's not good. It's more complex than that, but this is a TikTok and it gets the point across pretty well, I think. If you have jaw muscle pain, you need to make changes in your life to help the jaw muscles recover, not try to numb the pain with painkillers. The last step of the MEAT physical therapy protocol for helping recover from jaw muscle pain is treatment. There are a number of appliances and night guards that a dentist can make to help you manage jaw muscle pain. Some of these can help decrease how much you're clenching your teeth in the short term, and that can be helpful for recovery if you're in a lot of acute pain. I'm not going to go into the details about this here. Your dentist can get into specifics about the types of guards they recommend in your particular situation. If you want to know more about these guards, I did make a longer video on YouTube. It's actually an hour and 30 minutes long. It's all about night guards and TMD and TMJ and jaw muscle pain. You don't have to watch the whole thing. It has chapters in the video, so you can skip to the parts you're interested in. All the chapters are labeled. I've got a bunch of videos on dental health like that, all labeled with chapters on my YouTube channel. So you can go watch those and basically never have any dental problems ever if you follow the advice. Ask me questions about whatever you want in the comments. Stay healthy, my friends. I mentioned that jaw muscle pain and muscle pain from the shoulders and neck are the most common causes of jaw pain that aren't related to a tooth. It's much less likely to be the jaw joint. It is frequently the jaw muscles or other muscles of the neck and shoulders. Some of you still don't believe me because I have patients all the time who look at me like I have 3 heads when I explain this to them. So I get that. Here are the factors that tend to increase your susceptibility to jaw muscle pain. These are myofascial pain or muscle pain perpetuating factors. 1, emotional stress. That's a big one. Sleep hygiene. This is huge. If you're not sleeping well, you can actually get these central nervous system pattern generators, this stuff going on in your brain, similar to like restless leg syndrome where you're clenching and grinding your teeth a lot. This happens at certain stages in your sleep, but that regular overactivation of your jaw muscles while you're sleeping can really mess up your jaw muscles, cause a lot of pain. So getting your sleep hygiene right is huge to controlling jaw muscle pain. I'll recommend Matthew Walker's book, Why We Sleep. That's a good resource. There's also the Huberman Lab podcast with Andrew Huberman. That's available on YouTube and Spotify and Apple Podcasts. You can listen to the first month of that podcast. Talks gives a lot of really great tips on how to sleep better. It's been super helpful for me. Bottom line, you need a solid 6 to 8 hours, closer to 8 if possible, of good sleep each night. If you can't control your sleep hygiene, you're going to have a hard time getting a handle on and controlling myofascial pain. Jaw muscle pain falls into that category. Anxiety, depression, those are very much correlated and related to muscle pain, jaw muscle pain. Again, it just ties into the emotional stress, the overactivation of our sympathetic nervous system, very much a factor if you're dealing with anxiety and depression issues. Our posture, like head forward posture, where your head is, too far forward instead of your ears being lined up over your shoulders. This is a problem in the modern world. We're all staring at our phones, we're staring at computers, our head's leaning down. I like to read books. I'm always having to sit up straight to read my books. I look like a crazy person when I'm reading my books because of how straight I sit up. Anyway, if you can train yourself to have proper posture with your head, it doesn't put, extra weight and strain on those muscles up there, up on your neck and shoulder muscles, which again can refer pain up the rest of your head. Loss of descending inhibition. This is the idea of central sensitization of your nervous system. I don't know that I'm going to try to explain this on TikTok very well. But basically, this is when you've been in chronic pain and you're conditioning your nervous system to hurt even when the muscle is healthy. That's why it's so important to change behaviors at the onset of pain so that you stop the pain in the acute phase before it transitions to the chronic pain that you're dealing with all the time. I'm trying to help find you people on TikTok that have this problem and get you to understand it before it turns into chronic pain. I don't know if it's going to work. Also, none of this is your fault. Like, just because your body is clenching your teeth, that's not a thing you're deciding to do. I'm not trying to blame anyone or judge anyone. A lot of patients with pain like this are having a hard time in life, right? Permanent physical changes happen in your autonomic nervous system when you've been abused or have PTSD, anxiety issues. Like, it doesn't have to get that extreme, but it happens in those situations. Like, I don't want to make this too dark. Like, maybe you don't have anxiety issues or depression or trauma issues. Maybe you're just an overachiever who never learned to relax. You know, I can relate to that a little bit too. Dental school is a nightmare. I've actually talked to jaw muscle pain specialists about this, and one of them was telling me how, like, the majority of his patients are perfectionists. They have lots of anxiety when they aren't in control. You know, they have excess stress. They're control freaks. They try to tell everyone else how to live and what to do, you know, externalizing their stress into social relationships, which is what I hope I'm not doing right now on TikTok. Listen to me about how to fix your jaw muscles, everybody. Ugh. I'm trying not to be a control freak. I'm just trying to inform people. I'm sorry. Also, I want to point out, night guards do not stop grinding. It's a neurological phenomenon, not an occlusion issue, not an issue of how your teeth come together. Don't let a dentist tell you that they're going to change the bite with your teeth and that's going to stop your grinding. That is the case in a tiny, tiny fraction of cases. If you have instability with your jaw joint, like, then maybe, but it's super rare. That's probably not what's going on with you. So, like, yes, night guards can help in certain ways, but they don't stop you from grinding. And no, you don't need to have a dentist saw on your teeth and change the way your teeth come together to stop you from grinding your teeth. That's not going to work either. Very, 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 very rare cases is that something that should be done. I know it's not easy to deal with stress. I know life is really hard. I know it's not easy to process and move on from traumatic experiences in life. But I want to highlight for you that if you're someone with a history of jaw pain, it's often more to do with your muscles and nervous system than it is anything to do with your teeth. If you go to an orofacial pain clinic, that's a dental clinic that focuses on dealing with more complex pains of the mouth, jaw, face, you know, all this stuff up here. The dentists that work in those environments partner with physical therapists and psychologists to help patients get healthy. It's behavior modification and getting to the root of your stress, anxiety, sleep issues, depression, etc., that is going to help resolve your pain. And I say all of this as someone who has had bouts of severe jaw muscle pain and has had to walk down a long road to deal with stress, anxiety, depression, sleep issues for years. Like, I've had those issues, and it's not like I'm fully in the clear either. Like, I have my bad months or strings of months. Life happens. But cutting on your teeth or slapping a night guard in there isn't the best solution for most of this, all right? It may be part of the solution, but it's not the whole picture.